There's a fight in the nation's capital right now that could affect healthcare for millions of Americans, but it's not one you've likely heard about. At stake is a $42 billion infrastructure program and whether it should continue as planned. The money is for states to build high-speed internet, particularly in rural areas where telehealth currently doesn't really work.
A lot of people say that broadband is what's called a super determinant of healthcare.
In rural areas and remote places like Tribal Land, it is harder to find healthcare than other places.
And so broadband can be a game changer. It can provide something like telehealth where you can interface with a doctor who might be from afar.
In March, President Donald Trump's new Commerce Secretary, Howard Lutnick, said the infrastructure program is saddled with woke mandates and promised a rigorous review. Lutnick also declined to directly answer questions about the program during his confirmation hearing.
I can commit to you that if it has been rigorously done and deeply efficient, and it is the most efficient use to get broadband to your constituents, then it's easy for me to commit to it. But if there's been errors and mistakes, you wouldn't mind if we made it better.
Yet, others disagree with that sentiment and say it is critical that the program's money go out as planned.
The broadband grant programs were designed to overcome the economic and social barriers that have kept the hardest to reach communities offline.
Telehealth became a household word during the COVID-19 pandemic. Trump signed an executive order during his first term to improve rural health and telehealth access. But video telehealth doesn't work if you don't have high-speed internet. I spoke to Ada Carol Atkins, a stroke survivor who lives miles from the closest health clinic. Her phone and internet line often don't work at all. Telehealth is not an option for her.
I'm deep-rooted here, but things are failing me. My house is failing me. Phone service is a little wacky sometimes if I would have to call 911.
We wanted to know how many other people nationwide cannot use telehealth. We used data from federal broadband maps and George Washington University to examine counties across the U.S. We found that nearly 3 million people live in counties that share 3 crucial challenges: few primary care physicians, not enough behavioral health specialists, and a lack of high-speed internet. These counties are mostly rural. They're also more likely to be located in the South, Appalachia, and the remote West. We also found that people who live in these dead zone counties tend to live sicker and die younger than those in the rest of the country. Experts like Ollie say these locations shouldn't be without high-speed internet.
This keeps me up almost every night worrying about the future of these programs because we will never see this type of money again. This is a once-in-a-generation public commitment to what should be called a utility, what many people call a human right.